Welcome to the Soffa, a University of South Wales podcast on how psychology changes lives and our world for the better. My name is Dr. Klara Price, and on the sofa today we have Dr. Deborah Lancastle, an associate professor and a health psychologist. In this episode today, we will be discussing the psychosocial impact and aspects of women's reproductive health. Debs, welcome to this podcast.
Thank you. Nice to be here.
So what got you into researching women's reproductive health at the very beginning?
Well, I did my undergraduate degree in Cardiff at the turn of the century, and it got to dissertation choosing time. And at that time, I was very much into a programme that was on the television at the time called Ladette to Lady, which is all about alcohol consumption and bad behaviour in young women. So I'd wanted to do my dissertation on that. I knew who I'd wanted to work with, Professor Jackie Boivin, and I'd sent my dissertation proposal to her. And she was like, well, very good, very interesting, but would you like to do this instead? And that was looking at the impact of a particular medication on women's mood and work performance and cognitive abilities at the University Hospital of Wales. And I was like, okay, I'm always up to do something new. I like to do different things. And from that point on, I was hooked. It's such an interesting area of research to be into because it really does involve a woman's biology, psychology, and social factors. And those all interact sometimes to give women quite a miserable time. So from that point on, I was very much hooked. And I did my PhD then at Cardiff around infertility in women and the impact of waiting for pregnancy tests after fertility treatment, which is a really stressful time for women.
Thank you, Debs. And what was your very first project?
Okay, so this very first project, there is a sort of idea in the world that women are sort of at the mercy of their estrogen levels, and that when their estrogen levels go up and down just sort of during the normal menstrual cycle or at menopause, then that means they can't sort of function effectively. So this study was looking to see if women who were in a pharmacological menopause because of medication they've been given, and these are women usually have things like fibroids or endometriosis, and they're about to have surgery, and they were given this medication to try and relieve their symptoms, but also to get their sort of uterus or whatever ready for surgery. And the impact of this drug is to put you into a menopause, which helps relieve the symptoms. So it was basically a fairly sort of standard design where you sort of assess women before they have the medication, once they have the medication, and then after to see what the changes are. There wasn't much change really. Just when women were in a low estrogenic state, they were a bit more anxious really than the rest of the time. But their work performance was fine.
And how has this project led on to other projects that you've been involved in?
Well, it's sort of basically sort of developed this love of women's reproductive health. So that's why I did my PhD around infertility, because my supervisor, Jackie, was very much involved in women's infertility and has been a sort of world leader really in the area. So I did my PhD on that. But then I had the opportunity to do a postdoc in the Institute of Medical Genetics in Cardiff School of Medicine, and that was about ovarian cancer screening in terms of whether having more frequent screening was more distressing for women when they already had a family history of ovarian cancer and had seen members of their family go through some really difficult medical sort of circumstances. And then that was it really. So I got my job here after that, but I continued with research into women's reproductive health because it's the thing I most enjoy.
And what are some of the current projects that you've been involved in?
So for a number of years, some dissertation students on the MSc Clinical Psychology here, which I was course leader for many years, have actually worked on some of my research. So in the sort of in-between times, I did some work with a pharmaceutical company about uterine fibroids. And what became very clear during that work was that some reproductive health problems cause very heavy menstrual bleeding. And that often it's the case that women wait for a very long time before seeking help. And that sometimes doctors may not pay enough attention of women who seek help, but actually women are very good at accommodating to some quite difficult symptoms. They think it's just part of a woman being a woman. They don't want to make a fuss. They get on with it. They buy different sanitary protection and so on. And that can lead to quite a delay in them seeking help, to the point at which they can become really quite unwell. So one of the things that I found interesting in this was that most research studies that are published involve women who are already in the system. So they are the people who've been to the doctors, they've got a referral to a gynaecologist, the gynaecologist has put them in a trial, and therefore they're represented in research. But the women that aren't represented in the research are the women who haven't been to the doctors. And those are the people that might be suffering in silence with difficult symptoms. So one of the things I was keen to do was to find a way of doing research with those women, the women in the population who haven't yet seen a doctor or sought help for their symptoms. So I did a number of surveys over the years, and the MSc students would collect the data as part of their dissertations. And the upshot of that was that I developed a brief 10-item measure which assesses women's quality of life related to heavy menstrual bleeding. And that's important because the National Institute for Clinical Excellence actually suggests that that's what doctors should be looking at when they're looking to treat women's reproductive health problems. So that measure was published earlier in the year, and at the moment I'm looking to develop an app which involves that particular measure and other measures. And that's under development at the moment here at USW. So I'm very excited. I'm really looking forward to that, because I think it could help standardise assessment of women's problems and also make assessment more accessible. Because if you're not in a clinical trial, you're not likely to be completing the measures that would tell you you had a problem. So that's one. And another big piece of work that's ongoing with some colleagues here at USW is that we're looking to survey women who work at USW, or basically anybody who menstruates who work at USW, to find out their experiences of menstruation in the workplace. So some of my research was cited by the Welsh Government in something called the Period Proud Plan. And that work of mine was basically showing that women who have heavy periods miss more days at work each month than women who don't, and that when they're at work, they feel that their work is negatively affected. So the reason for this survey of women at USW is that I would like to find out how they get on with menstruation at work here. So it's about things like facilities, attitudes, philosophies, and various things like that, with the idea that we can perhaps put things into place that help them have a better time of it generally. So putting women on an equal footing with men who don't have to deal with those issues, really. Something I'm quite passionate about that. And I'm also a member of the menopause working group at USW, who are doing a similar thing, but more specifically tailored towards the menopause.
Thank you, Debs. And are there any other projects that you have been involved in?
That's all the sort of reproductive health problems that are ongoing at the moment. One thing that I try to do here is to help other students get involved in my research. So I mentioned before about dissertation students. So the way that we sort of run things at the master's level here is that we try to involve students in ongoing, meaningful applied research projects that they complete as part of their dissertations. They write them up, and sometimes they get a publication out of it as well, which is a really good thing. So I think there are 4 previous MSc students on the period qual paper, which is the one about quality of life.
And is there anything else that you would like to add to our podcast today?
I think one of the things I would like to say is to think back to my first thing I said is, how did you get into this? And the fact that I was actually quite keen to do something different. You know, in my head, the thing that I wanted to do around sort of the ladette culture of drinking a lot and behaving in a particular way was something I was really keen to do. And if I hadn't been open-minded to other opportunities, then I probably would have done that. And it may or may not have progressed as this has. So I think to remain open-minded, and it's good to have your passions and your interests, but also to pay attention to what other people might have available as research to get involved in, because it might lead to something really quite interesting in the end.
Thank you very much, Debs. It's been lovely chatting to you today.
Thank you.
And next we are joined by Gabreille Hale, who works as a lecturer in psychology at the University of South Wales and is also currently finishing her doctoral research project. Welcome to the podcast, Gabby.
So hi, Klara. Thank you for inviting me on to talk about my research today.
Pleasure. So, Gabby, how did you get involved in researching women's reproductive health?
So I first became involved in this area of research whilst I was a master's student myself. So I studied a master's in clinical psychology at the University of South Wales back in 2016. And as part of our master's, we have to complete a dissertation, which is a big piece of independent research, which you conduct by yourself with the support of an academic supervisor who is an expert in their particular area. And there were a number of different projects that we were able to sign up for. And Dr. Lancastle's research looking into the psychosocial impact of women who experience reproductive health problems, that area really stood out to me. So I expressed my interest in this topic, and then I was fortunate enough to work with Dr. Lancastle as well as Dr. Klara from the University of Stockholm. So we worked together to collect some data looking into this area, and this has fed into a number of different studies which have had a positive impact on women, but also I was able to use that data then as well for my own dissertation project, which helped me to pass the master's course. So my master's dissertation specifically, we was looking at the impact that women who experience problematic symptoms, so we was asking them about their menstrual history, as well as then measuring their quality of life, symptoms of anxiety and depression, and also psychological distress. And we was interested in looking at the experiences of all people who menstruate, so including individuals that would have very light periods that weren't causing any kind of like significant pain or discomfort, as well as women who had a diagnosis of a gynecological condition. So, for example, uterine fibroids or endometriosis, and also women who would report that they did have very heavy periods, but actually didn't have a diagnosed medical condition. And what we found through my study was that women who reported that they had very heavy periods, they had significantly lower quality of life, as well as significantly higher psychological distress compared to women that had light periods, regardless of whether they did have a diagnosis of a gynecological condition or not. So this research was really important, and it led then into a number of other studies that have built on this since. So specifically, it led to the development then of a brief quality of life measure that women can use in their own time to determine whether their periods are having a negative impact on their lives, and therefore whether they should go and seek help from a medical professional. Because before we did this research, we lots of the quality of life measures that were out there, they were targeted towards women that already had a gynecological condition. So, for example, there's a measure of quality of life specifically for women with uterine fibroids, but that would suggest that they've already sought help from a professional and possibly already receiving treatment, or they're aware of the condition. Whereas the measure that we've been able to develop from this research, it can be used as a tool, quick and easy for women to complete in their own time. And that then can help them to determine actually whether it does have a negative impact and if they should seek help or not. So it's great to see how these studies have built on over the time, over the past 6 years.
Definitely. Thank you, Gabby. And what are some of the current projects that you are currently working on?
Yeah, so since completing that piece of research back in 2016, my interest in this area has continued to grow. Going back to the quality of life measure that I mentioned, I contributed to writing a paper for publication describing how we developed that measure. So this has been published in BMC's Women Health earlier this year. And it also really sparked my interest in research in general on how we can use psychology to help people in the real world. And also those skills helped me with developing or pursuing a career in academia. So I went on to complete the PhD. And I've now secured a position as a lecturer here, and I'm supporting our current master's students to continue investigating this area of women's reproductive health as well. So one project that we're working on this year, which I'm sure Dr. Lancastle probably spoke to you about, is the development of the Period Pal app. So this app is a way that women can complete the quality of life measure in a more accessible way again. So some of our master students this year now, they're going to be evaluating a pilot trial of this app to determine women's thoughts on this app and whether it is a feasible tool to use. So we'll be asking questions such as, what features they like on the app, anything that perhaps they feel could be improved in some way, if there's any sort of specific information links they should be included on the app. So for example, reference to the NICE guidelines, and continuing then to validate that tool and test its effectiveness as well. So yeah, really excited to see the results that we continue to get. And it's nice to see how the research has come full circle, really. So I started as a master's student myself on this project, and now I've been able to continue with this area, and now continue to support our current master's students who get involved with this research and continue to have a positive impact then on women's lives.
That's lovely. Thank you, Gabby. And is there anything else that you would like to add to our chat today?
If we have students come into us, perhaps if there's particular projects that they are interested in, I think just trying to say yes to everything, really, and just really take any opportunity that comes to you, because it's great where it can lead you to, really, and the great things that can happen as a result.
That's amazing. Thank you very much for chatting to us today, Gabby, and it's been lovely to having you here on the sofa with us today.
No problem. Thank you for having me on.
Thank you for listening, and thank you our guests, Dr. Deborah Lancastle and Gabreille Hale. If you'd like to find out more about this podcast and our work, please search USW Psychology.